Good afternoon, everyone. I'm Zenobia again, and now I'd like to turn it over to our moderator today, Mike Heinisch. Before I do that, I just want to thank everyone for making time to have this conversation with us today. I think it's a very important conversation. So with that being said, I'll go ahead and turn it over to Mike Heinisch.
Thank you, Zenobia, and thank you all for joining us midday here on a fine day in September. Good Labor Day weekend coming up, hopefully for everyone. This conversation, Mental Health Town Hall, really began getting close to a year ago as a result of conversations taking place at the Government Affairs Committee of the Chamber. And little did any of us know we'd be in the kind of environment we're in, obviously, now as we're in the moving into fall of this incredible year. And so it's very timely in a lot of ways now, as it would have been back then even, but more so now. And I think a lot of us know many reasons why. I've spent my career involved with mental health issues of one kind or another, largely with children and family, part of what we do here at Kent Youth and Family Services, but even prior to this time here, to the start of my career, working on mental health issues. And so it's an area of not only practice, but policy at the county, state, and federal level I'm very familiar with, as are our guests today, who will really dive into the details of what they see from their perspective. But let me start by saying the world has changed, as we all know, and that includes in the area of mental health. We no longer use the term only mental health. We use the term behavioral health to refer to the fact that a continuum of behavior is involved here, and it includes choices around substances and substance use disorder. The spectrum is such that I've always talked about it being a bell-shaped curve. That on the one end of the bell-shaped curve, let's say the lower left end of the bell-shaped curve, you have people only dealing with emotional disturbances. On the other end of the bell-shaped curve, you have people only dealing with substance use disorders. But in the middle, you have the large section of the bell curve that really is, as we say, duly diagnosed, or in general behavioral, using both emotional disturbances combined with substances to ease the pain that they have in their lives. There's a lot of estimates going on right now about what the impact of our current pandemic is on the behavioral health of our populations. Very interesting. If you saw it yesterday, you might look at it after we're done here. There was a piece in the Seattle Times in their education lab section that talked about the emotional disturbances in families that are occurring as a result of stay at home and now online school. And the estimates by the state are that from 40 to 60% of the people in the state of Washington could be and likely are dealing with behavioral disturbances, significant behavioral disturbances. 60% of the people of Washington is over 4 million. That's a huge number and far above any prevalence rates that has ever been cited by the National Institute of Mental Health or any other healthcare body. So this is a time when this conversation is necessary, and I think we all feel it in one way or another. And really, it's the time. The other thing that's happened during the pandemic is many of us, we all have come to recognize the need for social supports, for the social determinants of health, for people's well-being. And I think many of you who have been around the chamber for a while know that, or have heard me say that quality of life is not just good jobs. It is good jobs. It is good school. It is a healthy economy. But business is not attracted to a community based on a healthy business climate. It's based on a livable community, which includes a stable workforce that has the supports it needs when times get tough for all of us. And that is the sole scope of the kind of work we do here at this agency, but in general, what human services does. It provides for those supports to contribute to the quality of life of Kent, so that we have the kinds of things that make for a good business community. So I'll stop there, and I'm proud to introduce our first speaker, Representative Deborah Entenman. I've known Deborah for a long period of time. She actually served on the board of directors here at Kent Youth and Family Services, and as you all know, she has long time been with Representative Ann Smith's office. She's also been very active in other organizations that are involved in children's-based work, and of course is down in Olympia now representing the 47th District. She serves on the Children's Mental Health Advisory Committee and chairs their Birth to Three subcommittee of that work, which is coming to fruition, and hopefully we'll have something to really contribute in the next session when it comes to children's mental health. So Representative Entenman.
Thank you, Mike. Thank you for the introduction. It is nice to be here with everyone. We have a lot of work to do. There are a number of things that are happening, including COVID, but we also have the civil rights uprising. We have people marching in the streets because they want police reform. And this is all affecting our community and us as individuals. So I think taking the time to acknowledge that is important. As a member of the legislature, I have a number of responsibilities. We all do. My priorities as we look at trying to rebuild our economy and get back on track in this time when we are dealing with an epidemic, a pandemic, sometimes I feel like I'm at odds, because when talking to people in the business community, they just want to get back to work. But I know that there is a infrastructure that needs to be in place so that people can go to work. And that includes safe and adequate childcare for children who are not school age yet, and for before and after school care so that parents can feel that their children are in a safe place if they have to have them outside of the home. But we are also hearing from parents that we need kids to go back to school. And when Mike was talking about the percentage of people who are being affected, there are a number of people who are concerned that because children are in school, we are not getting good data on children who may be in an abusive situation. So it is more of a priority that for some children, we reopen schools. So how would we do that safely in a pandemic? So right now, we are all doing school from home. There have been discussions about opening up some school spaces for some children because they really need to have a place to go. And others have talked about opening up what we call our before and after school spaces and supporting that, where we're not asking children to do anything academically. We're just allowing them to move about, interact with other kids, and have a place to burn off some of this energy. With that, we have money from the federal government, the CARES Act dollars. We have had some of our community partners step up, and there was a delay in them receiving payment for the work that they did when we first learned about the pandemic. And I'm hopeful now that they have received some of those funds. And I hope that as we move forward in the legislature, we not only remember our schools, but we remember our community partners like the Y, like the Boys and Girls Club, like Kent Youth and Family Services, and others who are also preparing a place that is supportive and caring for our children. This, as we think about going back to the legislature and what the session is going to look like, we are being pulled in so many different directions. For anyone who says that we are in an interim and legislators are not working, I am here to attest to the fact that we are working very hard. I commend my colleagues who have jobs that are outside of the legislature, because I am often reminded by my LA that I am working a number of hours and I need to take a break. Because I am always on the phone taking calls, talking to people about folks who are incarcerated and the care that they are receiving, small business owners not wanting to close, but who didn't receive any PPE and are trying to figure out how they stay open. I am cognizant of the loss of the Fourth Avenue Cafe in Kent, is where I used to do a lot of my community meetings along with Senator Doss, and that place is now not available to us. What I would like to say is, first, know that everybody I know in the legislature is working on something. So for people to think that this is an interim and we are not working, I would like to dispel that myth right now. We are all working. We are all working to improve the lives of the folks in our state. It looks like many different things for many different people, but rest assured, we are all working on something. We know that we have a budget deficit, and with the proposed budget deficit, there are people who are saying that we need to cut things. The governor's talking about that, and Office of Financial Management is talking about cuts that need to be made. As I think about going back to the legislature, either in special session or in January, if I am reelected, I am cognizant of the fact that we need to maintain services for families. This is not the time to cut any of those social services because the need is greater than it has ever been before. And so I feel that it is my responsibility to bring that voice and to protect children and families, especially young children and young parents, so that they can adapt to what this new normal is and thrive. Our goal is to get them back to a place where they feel like they can thrive. So there are many people who want us to restart businesses, but if we don't have the infrastructure of childcare and school for school-age children, it is going to be very difficult for us to restart businesses. So what we must do is figure out how we get PPE to schools, how we have a safe distance learning strategic plan for, especially for young children, and how we then pivot from bringing one group into being active in the community so that that'll allow the other group to be active in the community. But I think we really need to focus on the children first so that parents can then go to work and do what they need to do. But we can't have a system that focuses on opening businesses first, because where are the parents going to put their children? So we have to focus on children first, and that is my priority as we go back into the legislative session.
Thank you, Representative Entenmann. Let me just throw a couple things in before we move on. Deborah did mention that there's concern about with schools not being open, what's actually happening with children and child abuse. The referrals to CPS are down about 50%. I think we all like to think that, in fact, is a real number as far as what occurrences are, but undoubtedly it's not. And already with the Kent School District, a number of us are talking about an influx of identification of child abuse at a level that we haven't seen ever at the start of the school year. And typically we see a lot at the start of the school year. It's also true for domestic violence. Very disturbing that domestic violence is down by about 40% referrals. Again, I think we'd all like to think that DV has reduced that much, but in fact it certainly hasn't. There's a notion that we talk about in behavioral health world called ACEs. ACEs stands for Adverse Childhood Experiences. There are roughly 8 of them. 2 of them most prominently are child abuse and exposure to domestic violence. And it's well known in research that goes back decades that a persistence of ACEs experience in childhood leads to a disrupted life in general over a lifespan, having to do with ability to relate, having to do with replication of domestic violence or child abuse as a parent and a partner, having to do with work performance, criminal justice, use of the use of the healthcare system in an inappropriate way. So these are things that, again, regrettably, we know we're out there, but we're not seeing right now as a result of the situation we're in. All right. So Representative Orwell is representative from the 33rd District and has represented that district now a number of terms. Tina shares a history working in the mental health center, mental health system with myself. And because she is a social worker by trade, but has done a job in Olympia for us over the years that I think many of us are thankful for, as is the record that Representative Entenmann and Senator Dawes are building. But Tina, your turn.
Thank you. Thank you for that kind introduction, and thank you for inviting me today. It's an important time to talk about behavioral health. I wanted to just add on to what you were saying, Mike, is I work a lot with sexual assault survivors. And unfortunately, during this period of time, a lot of people were fearful to go into emergency rooms because of COVID. And we're also seeing an increase in child trafficking. So again, you know, sadly, I think we're worried about our kids, right? It's about our children. Well, I want to start by maybe talking a little bit about behavioral health and some of the things I'm working on for next session. But I want to start by saying it is stressful times. And I know it's been stressful on families. I know a lot of businesses that are out there struggling. I also think it's an opportunity to build something better, something more just. And so I think we have this great opportunity in front of us. For behavioral health, you know, I started during the Great Recession, and we made so much cuts to behavioral health, I'm not sure it ever recovered. So I'm very concerned going into the session that we keep that in place and actually build on it. One of the things we know after a catastrophe is it usually is a greater impact on a family as far as mental health 3 to 6 months after the catastrophe. And so you think of everything that's going on, the unemployment, you know, people struggling to keep their homes, and we're going to have the forbearances ending, the rental assistance. We know that, you know, families are struggling with healthcare and all those things that they need. So there is a worry that the next 3 to 6 months are going to be a challenging time. And so we want to keep all the supports in place that we can and actually build greater supports. So I really appreciate this forum because it's really an opportunity to talk about that. Some of the things that I'm working on, well, first I have to say Representative Entenmann is our lead around the police reform. I'm working on one aspect, actually a couple, but one is mental health and behavioral health response. And so I'm chairing a meeting that has our South King County police chiefs. It has Kelly Namoro, who runs King County Behavioral Health. It includes community leaders. And we're trying to look at how we could better set up our system in mental health, behavioral health to have a more, you know, assertive response. You know, people often are struggling. We looked at the ITA numbers and voluntary treatment numbers for King County, South King County, and it's actually 40% people of color. And so we have to think, what systems are we creating to outreach to families? We're including, you know, a lot of, I know Open Doors is at the table. We're trying to see how we can make sure we're really addressing this in multiple languages. You know, how do we build a system that really supports everyone in our community? And we're also including peers. Peers are a very effective model in behavioral health and can provide long-term support. So I think it's exciting. I think we have an opportunity to really make our system more robust. Behavioral health struggles with emergency response and that type of outreach because it's not well funded, right? It's not funded by Medicaid. And so we do have to find those other sources of funding. One of the other things that I'm working on is this SAMHSA, which is the Substance Abuse Mental Health Administration. They have these governor challenge grants. And so we have one in our state that I've got to be part of the team around veteran suicide prevention. In fact, the month of September is Suicide Prevention Month. And again, with our worries of stress on youth, on veterans, just on anyone at risk, we want to make sure we're doing everything we can to strengthen these systems. I'm on a subcommittee around lethal means, and we do know that there's been a recent increase purchasing of firearms, and a lot of it's like people's first time purchasing, and 80% of all firearm deaths are suicides. And so when we look at lethal means, we're looking at, securing firearms, but we're also looking at medication and other means. One thing I would like to ask the Chamber is September 10th is Suicide Prevention, World Suicide Prevention Day. And maybe there's a way we can send out a message around reaching out to those people who we know that might be isolated or struggling. So, it's a big time to focus on mental health, and, maybe we can share the suicide prevention line. So those are a couple of things I'm working on. Other things that I think kind of address different stresses on our families is foreclosure. And in the Great Recession, I tell you that Kent was very hard hit by foreclosure. We have an outreach committee that's looking at how we can work with El Centro and other agencies to really get resources and messages out there. But again, I'm concerned again that families are going to struggle after the forbearances. And we're also looking if we can expand that to help landlords of people that are renting out their homes that might be struggling as well. So those are some of the things I'm working on. But, again, I think I saw a campaign. I can't remember who had it, but it was, it's okay to not be okay. And I really think it's an opportunity when someone says, how are you, to really say, how are you? I mean, we're all feeling stress. I'm sure you're feeling it. And it's a time to talk about mental health and maybe in a way we haven't before. And so, again, I really appreciate this forum and highlighting that. And I think there's a lot of work ahead.
Indeed, there is. Thank you. Thank you, Tina. Couple things to comment on it that struck me there. I mentioned ACEs earlier. I said there are about 8 of them. Another one is sexual assault. And another one is housing instability and homelessness as a child experience, significant as far as lifelong disturbances. The representative mentioned outreach and engagement. It's really a big part of how you get people the help they need is to continually outreach to them, continually engage. I think if any of you have been to previous presentations by the Kent Police Department, specific to the homeless issue in Kent, you've heard the chief and others and his command say they repeatedly are reaching out to people and trying to engage them in services. And yet none of that is, in the behavioral health world, none of that is covered. And it's a significant amount of work that we have to do without any funding to do it. Another area is in law enforcement itself, and the work group that Representative talked about, she's pulled together. We've all seen the figures about the percentage of police calls that are actually behavioral health related and not otherwise law enforcement issues. And we've heard our law enforcement leaders say, clearly, if we can be relieved of that, separate from the issue of how police should be or shouldn't be funded, that'd be a significant burden relieved and more adequately addressed by professionals in the behavioral health field or clinical social workers or community health workers or whoever it might be to get people the help they need sooner, rather than acting as a gateway potentially to the criminal justice system. So a couple thoughts to add to what the representative said. So now we'll move to our distinguished senator, Senator Mona Dawes, representing the 47th in her first term. And we all know Senator Dawes, and I want, Senator Dawes, if you tell us your thought.
Thank you so much again for having me and for the Chamber for having this really important discussion. I'm pretty sure when we all left session last time, we really didn't realize how much time we'd be spending on Zoom and Facebook Live and those types of things and not meeting in person. And I want to just echo a lot of the thoughts that Representative Entenmann and Orwell shared. We are in crisis mode. None of us knew how bad it would be. And I think one of the things that I'm hopeful about, I'm an optimist. My family came here with $6, so I have no choice but to be an optimist. So one of the things I look at is you know, many of us, especially working in the space for a long time, have known how broken the systems are, right? We know our housing policies are broken, our food insecurity, our education, our unemployment, our police, you know, obviously folks are demanding police reform now and have been for a long time. And so one of the things that I'm optimistic about is being at the table along with Rep. Entenmann and Rep. Orwell and, you know, Rep. Kaiser and Mia and Pat Sullivan to really be there during the rebuilding. Because if we rebuild our systems that were broken, then we're not moving forward. And so I think we have a real opportunity to rebuild our broken systems in a better and a different way. And I'm excited about all of the diverse voices that we now have at the table and more coming. And so I'm really very encouraged by all the work that's been happening. As Representative Entenmann mentioned, none of us have really had a break since session. We've been working pretty nonstop to make sure that we rebuild in a way that's equitable and fair and just for our community, specifically for our community. As we know in Kent, you know, 148 languages are spoken in our community. So we know that we have communities that have not been represented for a really long time, and we're really excited to be the voice and to help. And I'd encourage any of you that have ideas. I mean, here's the thing. We don't have all the solutions. We are figuring this out along with you, along with our communities, along with our state, along with our country. So if you have ideas, please share them with us. We're all of our offices are open and interested in working on solutions together. Couple of things I'll share about the Senate. In 2019, we created the Behavioral Health Subcommittee, which Senator Moncadingra is chairing. And I think that shows our commitment to making sure that these issues are brought to the forefront. We also created the Housing Stability and Affordability Committee, which I have the honor of being the vice chair for. As my background, as many of you know, I've been in the mortgage business for 15 years, so I know a little bit about housing, and it's really a passion of mine. You know, I really do think that, you know, there's a lot of resources in our community, which I can talk about as we move forward, but I think to know that some of the things that I'm working on are continuing affordable housing, looking at expanding density, so to make sure people are housed and have a place to go. I'm in a situation personally when I can't afford to buy a house, but there's nothing I can afford to buy in my own city in Kent. So I'm in an apartment that's very expensive. And so I want to make sure there's that missing middle piece that we just really need more resources for. And so there's lots of things that we can do on the housing front that I believe we're working on. And as Representative Orwell mentioned, and I think Representative Entenmann touched on it as well, is extending the forbearance, extending the eviction moratorium, and really making sure that we help as many people stay out of housing insecurity and housing. You know, we know that once folks get evicted or lose their housing situation, that is extremely difficult and extremely more expensive for the state and for all of us to get them back into stable housing. So really the idea and the plan is to make sure that we prevent the foreclosures and the continue the forbearances and prevent the evictions from happening or folks losing their housing. The other thing I want to share is in the recession, which I wasn't there, I know Representative Entenmann wasn't there either, but it's, you know, a lot of what was focused on was an austerity budget and cutting things. And as we have now seen, and as someone has mentioned already today, when we cut services for our most vulnerable populations and we cut services for our people that need it the most, them getting back on their feet just takes exponentially longer. So I want to share that in the Senate, we talk about our budget as a moral document. And many of us have agreed that we will not vote for an austerity budget, that we need to really look at our most vulnerable populations as we are safekeepers and guardians in the legislature and our budget to make sure we really take care of those folks. And we look at other ideas for bringing in revenue, progressive revenue being one of them, closing a lot of corporate tax loopholes that are out there, another one. And so please know, excuse me, that we're working very hard, especially with the House, to make sure that we don't have an all cuts budget this time, because we saw the results of that and that didn't work. And so we want to make sure that we don't do that again, and that we are fighting and advocating for our most vulnerable members of our community. And thank you for having me. I'm really honored to be here.
Thank you, Mona. Let me just say a couple of things and to add to, or that I thought of while I was listening to the senator. A couple, I think all of them maybe have mentioned now that we're working for you full time. Just to remind all of us, these are part-time positions, but they're full-time jobs. There's just no two ways about it. In fact, I would say the same thing for your City of Kent Council members. Appreciate their opinion or not. If you can do that job, it's not a part-time job, it's a full-time job. So thank you from all of us for doing that as citizen legislators in a part-time position, but try to do a full-time job and your own full-time job in addition to that. In the years I've been in this business, I've become very familiar with other states and other state systems of a social safety net that have been that exists or doesn't exist. And we are fortunate in the state of Washington. We are far from perfect. Behavioral health system is a place to start. Childcare is another place to start. After school time, any one of the things that we've been talked about already. But we do have a remarkably built out system in place that's taken decades to get where we are now, of social services of all kinds. And yet, as I said in some of my opening remarks, we have to nourish it and help it grow and help it be vibrant. Otherwise, it's not going to be for when we need it. When we need it, we aren't going to be here. And that's what we faced in the last recession, when it was a devastation of the social safety net. And it really can't be where we go back to, because we're still trying to make the gains up, or still trying to get back to where we were pre-2008, 2009 in a lot of ways. So we should be proud of the fact that we built up a safety net, and now we have to nurture it and support it. And yes, it's got its own issues that need to be dealt with, and we're definitely working on them, as all businesses are. But we are here, and in order to stay here, we need to be, the system needs to be nurtured. So one of those people who's been a long time nurturer of the system here in Kent when it comes to human services is Marina Hansen. Marina has spent her whole career with the City of Kent in the Human Services Department. And of course, now over the last 5 years or so, she's been the Human Services Manager of the City of Kent. I'm proud to be a friend and a colleague of Marina's since I started here. We started about the same time, almost. So Marina.
Okay, thank you for the chance, everyone, to share some details about really just the very Kent-specific response to the pandemic. I also want to acknowledge that there are a ton of people and divisions across the city who are working really hard on great things right now, but for the sake of time, I'm really going to focus in on the human services response today. For those of you who might not know, the Human Services Division is part of our city's Parks Department. And our focus is really all about that community well-being, quality of life function that Mike mentioned earlier. A few of our primary roles include community planning, so we're always assessing and anticipating needs, working to develop appropriate policy and program responses. And we are also a funder, so we allocate both city general funds and federal CDBG funds to support that network of services that we've talked about today that is really there to respond to our community needs. And then we also convene and engage others in community problem solving to develop and improve our services. So additionally, if you're not aware, we're also a direct service provider in a few key areas. So we have a minor home repair program that really is there to support our low-income seniors and disabled folks who own their homes to keep them safely housed. We were actually putting the finishing touches on our 5-year strategic plan right as the pandemic hit. And our attention really shifted immediately to how we would and how we could respond. So we knew there was a critical need to act with urgency to support our nonprofit partners, as well as the people and communities hit hardest by the impacts of COVID. And while we had learned a few recent lessons, thankfully, about small scale disasters, we had an extended snowstorm, we had a pretty large apartment fire that displaced a lot of residents, and some flooding just all in that last year. We know now that nothing, unfortunately, really prepared us for this pandemic. I know it's not going to be a surprise to anybody here listening today that Kent has some unique challenges in terms of the pandemic. We know the efforts to limit the spread have, of course, led to unemployment, income loss, and also that increased need for help with food, utilities, housing, healthcare. And as Mike mentioned, that some impact of all of those stressors layered with social distancing and isolation, that really has collectively impacted our community mental health overall. We know that these stressors have disproportionately impacted communities of color, and given Kent's demographics, we know this is a significant issue for many of our residents. We also know that depression is highest for those who have lost employment, and those who identify with multiple race categories and whose incomes are less than $35,000 per year. And again, unfortunately, this represents a significant number of Kent residents. So we really know that we have a lot of residents that we need to be very concerned about. And also, we've talked about it a little bit today, our community-based organizations are stressed right now. These are our trusted organizations for many of our most at-risk residents. And they're shifting their models as much as they possibly can to continue to serve their clients, but they too are in the middle of a perfect storm right now with heightened need for their services and then that dramatically diminished amount of resource. So these organizations we know rely heavily on fundraising, and I don't know about you, but I don't think we're going to likely be attending breakfasts or auctions with 500 of our closest friends learning about their amazing programs anytime soon. The reality is that they shouldn't have to feed and entertain us for our support anyway. So, we know we need to continue writing those checks if we can. These are just some additional data points. I'm not going to go through them all, but they do highlight the disparities by race, ethnicity, age, education. This is the results that came out of a second wave of 2020 data collection. And it really does point to that fact that all of us have kind of experienced at least one economic impact or another, but we do know that our Black, Hispanic, and younger Americans have been particularly likely to face economic hardships, and those impacts, unfortunately, are closely linked with poor mental health. Here at the city, in order to continue being strategic and recognize the importance of an effective targeted response, we focused our work going forward into these 3 categories. And initially, we focused solely on the response. I think I mentioned earlier, we shifted in rather dramatic fashion straight to emergency crisis mode. Definitely feel like we're still there a good portion of the time. But eventually, we started to transition to more of that recovery model. So more focused on sustaining the partnerships that have been created, bringing in added resources, and working to make sure our service levels continue to be adequate to meet the need. Obviously, that's easier said than done. And then that resilience is really what we are striving for. And that was something that we had identified in our strategic plan. So learning from these emergency practices hopefully will help us figure out how to adjust more fundamentally in the future in stable times based on what we learn. I mean, we know that cities with strong and robust civic networks are better prepared to pull through these challenging times. And we really want Kent to be one of those resilient communities. Just in terms of our response, a few examples of what it looked like. First and foremost, I just have to say that this community has been absolutely amazing. We really are just so lucky to have so many members of our nonprofits, our service clubs, faith community, businesses, institutions who have pretty much jumped in full time to respond to this crisis, or at least it seems that way to me. Just working to ensure people have access to food primarily, but also masks, hand sanitizer, diapers, formula, and any other basic need that we know people need access to. Honestly, I wish I could name every person, but that list is long and I would no doubt leave people off. So suffice to say, huge thanks to those working on food distribution as part of the Kent Community Partners Group in particular. And also there were tons of city volunteers last Friday who helped with an event that got needed supplies into the hands of thousands. Our staff has also just really tried to stay in close contact with both our funded and non-funded organizations serving our residents, just to try to keep a strong handle on what is still available and where those gaps might be. We have worked really hard to provide flexibility to our funded organizations, knowing that they've had to adjust and adapt their program models to keep serving their clients. We worked with the food bank to shift to a drive-up model. We've helped with the food distribution challenges and connected nonprofits and churches to face coverings that have been provided to us primarily by King County, and those have been very popular. I have to give SCAC a quick shout out here for their willingness to take on and organize the pickup of boxes and boxes and boxes and boxes of those masks to get them in the hands of the groups that can get them out to our residents. And then also our recreation and senior staff have shifted their service delivery models as best they can as well. Kind of more over on the financial side, we've spent a lot of time advocating for equitable distribution of resources. So private foundations, I think everybody knows, have poured a lot of money into our region. And our role here at the city has been kind of to have a voice in influencing how those funds are dispersed. So while we are always grateful for the support, sometimes that money doesn't get to those who are most in need simply because the methods that they choose to distribute them can be inherently inequitable. So for example, first come, first serve might sound great at first glance, but it really does favor those who have resources already versus those who might not have access to computers or Wi-Fi or whose first language is not English, and so on. The City of Kent also allocated additional federal funding to help agencies responding to residents directly impacted by COVID. You've probably seen some of the CDBG, CV funding notices out there. We also helped out Catholic Community Services by letting them have some additional resources to expand their community engagement center to increase the hours and staffing to ensure our homeless residents have a safe place to be during more hours of the day. It's not perfect, we know that, but we've done kind of what we can there. And then the city's economic development team is allocating 1.5 million in CARES funds for small business grants. We also just wrapped up our normal human services funding allocation process. Mike was a part of that, and I'm sure he would agree that we spent much more focus this time on equity and some of the fallout that we know we'll be seeing from COVID. When we talk about recovery and our shift to that, we really have made an effort to listen to our community to determine really what that means. And that list you see there is really where that came from. So we're still focusing on responding to increased community need for these categories. You know, we feel like we've done a pretty good job addressing that food security. We're worried, of course, about the anticipated influx in need for rental assistance and eviction prevention services when the moratorium on eviction is lifted. There are, you know, people have mentioned a lot of resources that are being directed to this issue, but we know it also, you know, it won't be enough. So another thing that we're really concerned about is just the future of sheltering. That standard congregate shelter model, which Kent has relied upon for 20 plus years, is just simply not something that we're going to be able to go back to anytime soon. Honestly, if ever, it's really just not safe and it's not the greatest model to begin with. So for now, we believe that hoteling, which is kind of how that's being dealt with now, that's probably going to continue through the winter, but how we go forward after that, we really, unfortunately, it's kind of one of our biggest unknowns. And we know people want to get back to work, and we know we're going to need some additional job training resources for that to happen. We really want to focus on getting Kent residents and Kent jobs. And I think several of you have mentioned childcare. We know that's a huge issue. And of course, mental health and behavioral health, everything that Mike has said today. This isn't an area that we have a ton of control over, but we do fund some services. We work closely with public health. Mike mentioned that increased concern about substance abuse and chemical dependency. There are definitely some concerning trends right now related to opioid use and overdoses, not specific to our homeless residents. I think a lot of us tend to go there, but it really is happening in every income bracket. And unfortunately, I think Kent is second only to the city of Seattle in those numbers right now. Quick call out on these two populations specifically. I know I'm spending a lot of time talking, but there's a lot to say. We know we need to focus some extra support on our youth social, emotional issues right now. If kids aren't around positive relationships, if they don't have access to social activities because those programs are closed and they're at home learning, maybe taking care of younger siblings, all of those challenges lead to fewer opportunities for their pro-social development. And then, of course, our older adults are also facing more social isolation and loneliness. You know, the quarantine is great because it limits their exposure to infection, but it's also limiting their social interactions. And the end result of that really ends up being its own health concern. I think we saw numbers that even before the pandemic hit, there was an estimated 25% of adults over 65 who were socially isolated. And we know that that number is, I don't know, triple probably now, I'm guessing. And again, thankfully, our senior center staff are very keyed into this, and they're doing great work trying to make sure that those connections are still being made. These are just some examples of the work that we're doing more related to that recovery effort. So we are meeting with other providers of youth services in the Kent School District to consider implementing connection hubs. We're working with other South King County City Human Services planners and child care resources to really key in on that child care need in our community. I think we've mentioned that being such a huge thing that needs to happen before we can really truly get back to work and have people stable. And then we also, as mentioned previously, just allocated that additional CDBG CV funds to agencies that will respond to community need that's very specific to the COVID-19 impacts. And that does include some micro enterprise assistance, as well as some trauma counseling. Resilience, we are not here yet. That's really all I think I need to say about that. But we know we need to align our short-term emergency response and investments into those long-term economic outlooks. So there's just so much we have to do. We have to keep investing in early intervention. Sometimes it's really tempting to think we can just stop all of that and put everything into basic needs. But if we're talking about long-term resiliency, we just, you know, we know that that can't be our strategy. So we'll keep increasing self-sufficiency. We're going to keep going with our expanded community engagement. It's going to look different, but we're still doing it. And then focusing really, again, on just everything that we can possibly learn from this in order to be more prepared going forward. There's some great data and community resources out there. These are just kind of specific ones to the data, the resources that are available, and the Kent specific partner list for anybody who wants to check that out. And then because we're talking a lot about mental health today, we have a really fantastic list of primarily local agencies who are going to be very critical in the response to the pandemic and getting back to that new normal, whatever that might be. So we have a great list for anybody that wants it. We can send it out with actual contact information and links. And then because I am always the eternal optimist, I didn't want to give this presentation without including some of the good news pieces. King County recently dedicated $41 million in rental assistance The USDA recently extended the federal waivers for summer meal programs, so that's going to continue to go until the end of December or before the funds run out. Staff is in early conversations with the foundation to develop a Montessori type preschool in Kent. They're going to basically do all of the upfront, including tenant improvements, training teachers, materials, and are willing to spend up to $25,000 per child to fund that center over a long-term period of at least 10 years. And then they've made a commitment that that preschool will really focus on that 200% of the poverty level and reflect the language and ethnic diversity of our community. There have been some amazing partnerships. They continue to form and strengthen. And then I just wanted to quickly plug the pandemic EBT. That's been extended, that deadline, to September 11th. So there's still time to make sure families are getting signed up. But without going into a ton of detail, that can mean up to $400 per child for families to spend on food. So I think we're sitting at around 18% of eligible Kent kids signed up, which is sad. That's a lot of money that's sitting out there that could be really helpful for right now. And then I'll just end with a couple opportunities. Again, check out the Kent Community Foundation. There are definitely ways, if you have a business, that you can help pitch in, provide resources to your employees, your friends, your family, anyone who might need extra support. Share the word about pandemic EBT, and please, please, please continue supporting your local nonprofit friends. They all need us right now. So thank you so much for the opportunity to really drill down into the Kent specific response. I know I had a lot of information, but happy to share the slide deck for anyone who might want to take a closer look at it later. Thanks, Mike.
Thank you, Marina. There were a couple requests to share the slide deck, and I'm sure the chamber will. Let me just add a few things as I try to do with all of our speakers, and then we'll go to Zenobia if there's questions that you've gotten. You know, Marina mentioned prevention. Excuse me, prevention. And there's an old expression about you can't measure if prevention was a success or not because something didn't happen. But I also frequently say that a juvenile standing in front of a judge, that's not the time when the problem started. That is not the time when the problem started. The problem started years and years before that kid is standing in front of a judge. The same thing can easily be said about any adult criminal any adult criminal justice proceeding. If you look at any example, current or going back decades, any and every one of those high profile cases we can all think about have some kind of trail in their past of ACEs and other things that could have been dealt with far, far upstream, as we say, in order to prevent that happening in front of a judge. Another expensive system that we have to support based on not supporting a safety net early on. She mentioned our pivot to doing remote things with kids. We are here at Kent Youth and Family, as our colleagues are doing. We are doing a lot of remote work like we're all doing, but it's very difficult to do remote behavioral health with a 6-year-old, with a 7-year-old, with an 8-year-old over a screen at home when there's 4 other kids running around and mom or dad are looking over his shoulder to see what's being talked about in a confidential situation. That's very problematic. And to say nothing of preschool kids and trying to, in that environment. A shout out to the Kent Community Foundation for the work they've done in bringing together a huge partnership in Kent in response to the COVID. Marina mentioned that. Let's think for just a second. When each of us was a child in our childhood and the things we did during the summertime alone, how different would we be if we spent 6 months, a year, God forbid, 2 years at home with no social development opportunities, no social interaction with your peers? How different would any one of us be? A compelling thought. If you look at the healthcare any one of the health measurements in King County, whether it's some kind of health measurement, or it's a juvenile justice measurement, or it's a criminal measurement, or it's COVID, or it's economic, all the disparity is in South King County. It's just remarkable. Every map of South King County, if you lay one over the other of any measurement of health in general of a community, all the disparities are here in South King County. Not to say that we don't have strengths and we don't have dynamism and people who want to be here and want to contribute, including our ethnic minority communities, including our newly arrived people. This is where the disparities are. Let me just also say quickly that Marina mentioned we just did the human services funding for the next 2 years. I think we should all be proud that the city of Kent really led the way in developing this human services set aside and a human services commission back in the mid 80s, almost 35 years ago now. That's one of the first cities in the county to do that and continues to do that to this day. And also Zenobia was part of that review process this year and knows that it's an arduous process. And as one of the agencies that's funded by the city of Kent for the work that we do, I can assure you, we are held accountable. Your public funds are not coming to this agency or the others on that list without an accountability measure going back to the city and back to the community. Any one of us can ask for what did Kent Youth and Family Services produce with the dollars you gave them. So just to say those few things. Zenobia, do you have anything?
Yeah, thank you. Really great information. So we are day 2 here at my home on homeschooling. So the back and the forth and the camera off and on, that's what that was about. And I allowed her to make herself something to eat. So that's what the last one was about. But anyway, I think that this is really good information. We started talking about having this conversation months ago, maybe almost a year ago to have this conversation because I saw that there was some sort of disconnect with the business community. My number one job is to be a spokesperson for the business community. But because I've always had a passion for human services and I've always been involved, at a city level on what we're doing for human services, I wanted to kind of point out, and I understood that there's a marriage there that we need to understand. If our community isn't healthy, whether it's the business community isn't healthy or the residents aren't healthy, we don't have a healthy community. And so this conversation is really opening that up, and I appreciate that. We have some really great questions that have come through. I know, Carmen, that you received some from Scott as well. And then we also had one of our attendees talk about something that it almost answers one of the questions that we received, like what are some of the resources right now that someone can use, whether that's online. And so I'm going to give a moment before we get started, because I don't know if she's actually on that list. I'm not familiar with the services. So Sarah, I'm going to go ahead and I'm going to try to allow you to speak according to what Zoom is saying. Are you there, Sarah?
Yeah, can you hear me?
I can. Awesome. So just introduce yourself, the name of your organization, and I'll give you a couple minutes on what it is that you're offering for the community.
Yeah, I'm Sarah Andrews and I work for Peer Kent. We are a new organization in downtown Kent. We are going to be providing peer coaching services at no cost to families of youth and adults that are struggling with mental health challenges and substance use disorders. We will also be providing support groups every day of the week once we are able to open, and just addressing any support that we can for people struggling with employment or housing challenges. So we just have a lot of really great people that are ready to work with the community once we're able to.
Awesome.
I'll give a shout out for Peer Seattle. They're a fine organization. I'm delighted that they're joining us here in Kent. Going to be a neighbor here in downtown Kent.
It's nice to finally meet you, Mike.
Wonderful. Well, thank you, Sarah. I wanted you to be able to explain that because, it's the services that you're offering, and we'll connect, from a chamber level at a different time. So
thank you.
Some of the things that came up, So is there anyone here on the line really that can provide, some of our panelists that can provide techniques to help with reduced stress for work from home workers or parents, or either lead them in the right direction where they can find that information? So any techniques to help reduce stress, work from home. Before you answer that, we do have an event coming up middle of this month with Valley Medical. They're going to be doing a presentation on this exact thing. But if this question just cannot wait and someone has some resources or answers for that, I'd like to be able to provide that to the person who asked the question.
Any of our legislators have thoughts?
Well, hi, this is Tina. That's a great question. You know, I think it's been so interesting through all this is that, you know, we're doing more things online. One of the things I saw the other day on Facebook from some of my colleagues from UW is DBT in the schools, and they're working with parents and students on emotional regulation and the skills that maybe parents can help kids have. So I do think we're seeing even the counseling going online. A lot of our providers are, you know, doing the kind of one-to-one Zoom calls for counseling. So again, you know, it sounds like maybe it would be helpful to kind of get a list of some of these things together. And I would imagine, Mike, you know, some of those too, but yeah, I think it'd be nice to do some kind of posting on that.
Yeah, thank you, Tina. We'll do that. I mean, this is, again, a conversation that's been in the works for a while, and I think maybe a one-sheeter. I am also connected with the, they just changed their name, the Kent Community Partners, and so we get a list of, you know, resources, I think, every week that we can start to do a better job as a chamber of getting that information out as well. So there was a question back to that. I mean, everything has transitioned to online. Is there, what are your feelings about mental health? Where's the question here? Does that really work? Does an online mental health therapy, does that actually work? Are there any bottlenecks with that?
Yep. So I guess I should take that. Let me just say, as far as stress reduction at homes, to go back to that just quickly, take a walk. How many people we see walking in our neighborhoods now? I mean, get away for just a minute. Walk down the block as just one small thing to think about. So doing telehealth, we were able to quickly pivot, as a lot of people, as a lot of organizations were. You know, it was a type of service that was not allowable under either HIPAA or under federal regulations of one sort or another having to do with healthcare provision. Fortunately, that changed quickly as well, which allowed for it to happen. But it does involve, as I said earlier, it does involve the ability to have some confidential space to be able to speak, in our case, to a child, and an attention span issue, although we're trying to do different things to maintain attention in a screen format. But it is difficult, and yet we're managing, and we are making our usual strides with kids in treatment. I think many of us probably have had the experience of going to your doc remotely. I had a dentist appointment remotely, God knows how, but that's what it was. While it's not ideal, it is manageable, and we're learning. And there's opportunities to get better at it when we need to, but at least it makes it accessible. And of course, the issue of good access is a great concern, meaning you have the right hardware and you have the right broadband, et cetera, to maintain a connection.
Okay. And so what is it that the business community, because I think there's that disconnect, right? We are, as a community, used to going to these, you know, breakfast and lunch and dinners and galas and hearing about the information, and that's just not possible. And so what is it that the business community can do for a couple of things? What can we do for the mental health of our community? And then also, what can we do from a legislative point to help you all push what you need forward? Because I heard a lot about, we're not going to cut mental health, we're not going to cut these services. And with my limited knowledge, if you're not going to cut one thing, you've got to cut something else. So, or you've got to get money from somewhere else. And so I appreciate the mental health aspect of that and not pulling from that, because obviously, like Tina said, it hasn't been able to recover since the recession. So if you're not going to cut human services, what is on the table for cutting, and what do businesses, either need to worry about or maybe be more abreast about?
Who would like to start with the solution?
Well, as I mentioned, there's two, and you're absolutely right, Zenobia. And I'm not going to say that we're not. Austerity measures is something that I think many folks will agree with. Now, when we get to Olympia, everything is on the table. So I wouldn't say that we're for sure not cutting these things. I know that many legislators that I have talked to have committed to no austerity budget or reducing the austerity impacts that we had last time. Many folks were there last time, and we're still digging out of those holes. So I would say, two ways, like you mentioned, increase revenue. So that would be progressive revenue. There's a lot of progressive revenue work groups happening right now. I hear that things are going well and that we've got some potential solutions, workable solutions on the table. I'm not on that work group, so I can't speak to the work that they're doing, but I know that it's going well. And the other piece would be we have a lot of corporate loopholes. I think there's over 100 of them. And so those are the types of things that will be on the table. And I think I honestly think everything's on the table. I think this is really important as to who's at the table making these decisions, to make sure that austerity budgets are not the way, as we've talked many times. I mean, for me, we talked about, all of these issues: police reform, education, environment, housing. These are not solutions these are not problems in silos. And so we have to address them in a systemic way. They're all interconnected. So how does one affect the other? And we need to look at what is the systems approach to making the changes that we need. And again, mentioning that, we have an opportunity, and I think Tina, Representative Orwell said it as well. We have an opportunity to create something different, create something where we don't have so many inequities and so many people left behind. And that's what I'm excited about. And I will pass the baton to either Rep. Benjamin or Orwell to share their thoughts too.
Invited to attend Multi-Service Center Health Luncheon on Thursday, October 15th at 12 p.m. Multi-Service Center is a nonprofit serving low to very low-income households throughout South King County with resources such as housing, employment, education, and energy assistance. During the COVID-19 pandemic, they have continued to offer their services, pivoting quickly to provide remote services to an increasing number of individuals, families, and seniors who face economic insecurity. You can help by joining MSC at its virtual fundraiser luncheon, the MSC Helps Luncheon, on October 15th. If you would like to learn more about what they are doing in the community, you can visit Multi-Service Center website at www.mschelps.org. Again, you are cordially invited to join the MSC Helps virtual luncheon on Thursday, October 15th from 12 p.m. until 1 p.m. They will also be streaming live at MSC Helps on Facebook and YouTube. We'll see you there. Awesome. So that's just one way that organizations are pivoting, and they're still letting folks know that they're still doing the great work. They're still doing more work with COVID-19. So you should probably see a lot of those organizations offering those same events online so that you can stay connected with the nonprofits that, that kind of speak to your heart, or, you have an interest in moving their mission forward. Carmen, I just wanted to see, is now a good time? Are you able to chime on before we end? Is there anything that you would like to add? Carmen is our Government Affairs Chair, co-chair, along with Jennifer Hammer. And so just wanted to give you some time to close the loop on some things or ask any questions that you may have.
No, so I had construction around my house, so I was trying to be diligent on not having background noise. But as always, I'd like to thank our elected officials. As Representative Intiman said, goes before you. It is not an easy job. There are tough calls to make, and we plan to be a voice and an ally to work with you, but also communicate our point of view as you go into each one of those conversations. In the upcoming months, we have elections coming up for those that are out there, and we will be working on having a candidate forum, virtual. Of course, highly recommend you order dinner in from a local restaurant, and then we virtual dinner all together and support our communities. Thank you again for bringing this topic. In the business community, you look at the top line, but there's a lot of things that impact how your bottom line shows up. And so as we move forward in this next session, and I believe you mentioned it was progressive revenue, we're going to be listing out, and we're going to be tuning in and providing feedback as often as we can to support you in making the decisions for our community. So that's all I want to say about that. Thank you, ladies. And Mike.
And Marina.
And Marina, yeah.
Again, I just appreciate you all coming on and taking time to meet with us. I think every time I've asked this group of folks to come on and share some information, you've done that, and I appreciate that so much, because again, there's, you have to know when there's an opportunity for you to speak, and it sounds like, and this is for me too, we don't know when to speak up and what to say, and it sounds like this open dialogue of communication is really what we need from the business community and our legislators. So just wanted to say thank you very much. The door is always open. You will get a formal invite to our government affairs meeting to make sure that you don't have any questions. So quickly, we are going to go over some of the events. Like Carmen mentioned, we do have the Legislative Candidates Forum coming up on the 1st of October. And that, again, so all of these are going to be held online. So that's the 1st of October from 11:30 to 1. Just going to go ahead and register on the Kent Chamber website. We also, with our partnership with UW Medicine and Valley Medical Center, they're going to be hosting Improving Work Productivity webinar, and they're going to be using their community wellness coordinator. So I think there's going to be a lot of great information shared on that as well. That is also another free event through the chamber. And then the third event I want to talk about is the Port of Seattle webinar. So you have the Port of Seattle Commissioner coming in. We have at the chamber had the opportunity to go in and speak with the port and work with them on some of their changes since COVID-19 and some of their bottlenecks, and we're working together with them. So I'd love to have you join with Stephanie Bowman, Port Commissioner. And then of course we have our CEO roundtable with the U.S. Chamber of Commerce Executive Director of Congressional and Public Affairs. And so all of these events can be found on our Kent Chamber website, and you are welcome to join them as a member, and some of them as a non-member. Last but not least, thank you so much to our sponsor today for our event, Shannon and Associates. Thank you so much to Scott Schaefer and Teresa Schaefer with I Love Kent with South King Media for streaming live for us on Facebook today. And then of course our commercial break sponsor, which is MSC Multi-Service Center. And then all of this program is made available to you through the sponsorships of our members and our investors. And I do want to say that during this time of COVID-19, 2019. The Chamber is a membership-based organization. And so when you're talking about a small business or micro business, we are right there with you. We understand what you are going through. And we have some wonderful partners that continue to support the Chamber as we continue to support the business community. So we just want to say thank you for that. And if there is nothing else, and for the good of the order, I will allow you to have the rest of your day back. Have a wonderful day. Thank you so much.
Thanks for having us.
Thank you.
Thank you.
All right.
Thank you.